What is biofeedback in a very simple terms?
Let me explain. So I told that there is disharmony between the muscles which contract and muscles which relax,
Mm,
isn't it?
mm,
After finding out through anorectal manometry, okay, this is the problem, then we involve the some of our physiotherapist, some of the it's basically a digital treatment. Why I say digital treatment? See, you are a, I would say, a digital doctor. You have created revolution in the world by producing, I mean, by providing lot of information. We are in a digital revolution.
mm,
Likewise, I can say this biofeedback is one of the medical digital revolution,
mm,
because people need not be there in the lab or in the with the physiotherapist every time.
mm,
Initially, they have to learn how to make the pelvic floor relax.
because it is contracted.
It's contracted.
Ah,
So it's like a form of physiotherapy. When
mm,
somebody is having stroke, they have to make use of the physiotherapy to bring the muscles back.
correct.
Likewise, this pelvic floor muscle is already contracting. So we have to educate. As I told you, it's not in our hands.
Mm,
It's a training we have to give.
mm,
So using the very sophisticated transducers and some visions. See, suppose if you have, I mean, a stroke, with power we can use our hands and legs. But whereas pelvic floor requires some sort of simulator, some sort of visual things to make sure that we are having a command over the pelvic floor.
By
That's
looking at something, you are aware of what is happening inside.
Yes. It's basically we are training our pelvic floor muscles to relax and to contract based on the visual scores. So that's the laboratory training.
Mm,
See, in about 10 days time, they know how to contract, how to relax. It's like a swimming. See, when somebody who doesn't know swimming, in about 10 days time, we learn the swimming
correct.
or driving. Like that, we know how to control the pelvic floor muscles by this biofeedback. Initially, I thought something is different, but once I learned this, okay, this is a form of learning, making our pelvic floor muscles to learn when to contract, so that we know. We have a control over the pelvic floor. When somebody is pushes, we have through some maneuvers we try to relax. Already, which we have already trained in that training sessions, and we can practice at home. So that's why I call it as a digital treatment.
Digital treatment.
You learn it in few contact sessions, and then you can go for training yourself for long so that you produce good results.
So in my practice, sir, we see this biofeedback helpful for both constipation and also incontinence when
Yes.
people are having fecal leakage and urinary leakage sometimes as well. So fecal leakage, fecal accidents, you will not even imagine the amount of problem that they have.
It is social stigma.
Social stigma, yeah,
Stress, urinary stress incontinence. Imagine, see, that's a big. I've seen people not going out for this, either
correct.
fecal incontinence. For those fecal incontinence in the sense leaking of motion or leaking of urine. So this is basically a big problem. From medical point of view, it may not really. It's not life-threatening disease. From social point of view, people not going out,
Correct.
staying at homes, glued to indoors. It's a big thing. This is exactly the reverse of what we teach for constipation.
Constipation. Ah.
We make them contract more.
Mm.
So
The
in
pelvic floor needs to contract here.
contract, yes, so that to have a control.
Ah.
So for it's like a gatekeeper. For some, it has to make a real, I would say, gatekeeper, so that it should not allow something. At some point, when something has to go out, it should make way. So that's the pelvic, amazing organ, I would say, pelvic floor
Exactly.
muscles.
It
So
is
it's
one of the beautiful organ.
yes. So the for fecal and urinary incontinence, we teach the opposite. How to make more, how to make it contract more. In I mean constipation, we have to train the muscle how to relax more. Whereas in fecal incontinence and urinary incontinence, we have to teach the pelvic floor how to contract more. This is again the job of the physiotherapist and the special healthcare providers to make it whether to contract more or to relax
Relax
more
more.
depending on the situation.